Hello friends, welcome to Hip and Knee Clinic, and today we are going to discuss about Colles fracture by seeing one case example. And Colles fracture is one of the most common fracture in older age group. So this patient was 47-year-old female, fall on outstretched hand, and patient having injury to the right hand. On examination, there is a swelling, deformity and tenderness, and range of movement is painful. So this is the clinical picture of typical Colles fracture patient, and the hand look like dinner fork deformity. You can see there is a dorsal angulation like dinner fork at the wrist joint. So this is very common, and Colles fracture deformity seen is dinner fork deformity. This is the X-ray of wrist, and you can see there is an extra articular fracture that is not involving the articular surface, and there is a dorsal angulation. So the extra articular fracture with dorsal angulation is Colles fracture. So what is the management of Colles fracture? We can treat mainly by close reduction and immobilization by POP cast. Another mode of treatment is close reduction and K-wire fixation, and last one is open reduction and internal fixation. This one is the close reduction and immobilization. Once you give traction, this fragment fracture can reduce, and for correction of the dorsal angulation you have to flex palmarly and you have to deviate ulnarwards. So this is the post reduction X-ray. You can reduce this fracture in operation theatre under C-arm with hematoma block. So this is the history of Colles fracture. It is the most common skeletal injury of distal radius and referred to as Colles fracture. For centuries, this injury was mistaken as dislocation of the wrist joint. It was probably first described as a fracture by Claude, and this description remained obscure. But accurate description is given by Abraham Colles in 1814. That is widely regarded as definitive description, and he was anatomist, and hence the fracture is known as Colles fracture. So he is the one, Abraham Colles, who described the Colles fracture, and he was surgeon and anatomist. Thank you.